Hello. Hi. Hi. Sorry to interrupt any conversations that are happening. I know that there's might be a lot of processing going on, but I don't want to make the organizers mad and going further behind. So here we are. So to this final panel, well, first of all, congratulations, you've made it to the end of day one of the summit this year. Give your hands a little clap. I think there's still coffee if you need it. This session is titled Community-Driven Responses to Queer and Trans Research Gaps, and this is highlighting work that's from the Investigators Program, that if you know about. It is expanded nationally. We're going to hear from 3 different programs. If you don't know about it, you'll learn a bit about it, and we can tell you a lot more. And this photo, if you can see it, is from the Edmonton Men's Health Collective, an artist by the name of Liam McKenzie, at Liam McKenzie Photo on Instagram if you're looking for a new follow, and I think it's an incredible photo. So just to start, acknowledging that we are on the traditional Coast Salish lands of the Musqueam, Squamish, and Tsleil-Waututh people, and as a queer person of color, as a settler, always important to reflect on ways in which Truth and Reconciliation Commission's calls to action play into my work and into my life, and I invite other folks to reflect on that as well. So as a brief outline of this presentation, you're going to hear from 10 people total, including myself, so it's going to be a rapid turnover. First, I'll tell you a bit about the Investigators Program, and then we'll hear from folks from the Edmonton Program, all seated here, which will be talking about analyses that they did looking at the Sex Now survey from 2018 and data specifically in Alberta. Then we'll switch over and hear from the Vancouver investigators who have done a qualitative research project looking at access to PrEP for folks in Vancouver. And then we'll also hear from the program coordinator in Toronto to hear what's going on there. So lots to go through, and let's just get it started. So the Investigators is a volunteer program for young, gay, bi, queer, trans, and two-spirit men, not just in Toronto, as a slide might suggest, but across. Maybe I'm biased. I used to work for that program. So it is a program that is run now nationally in 4 different cities, and it's essentially a program to learn about queer men's health and community-based research in Canada. There's a real focus on giving young community members practical, hands-on experience with a research project and having involvement at many different stages in that. It was established in 2011 by Dr. Olivier Ferlat, over there, if you want to give thank you, Olivier. And it is really not just about building capacity for community members outside of academic institutions, but also to enhance the research that we're doing here at the CBRC and to involve community folks in lots of different ways in the work that we're doing. So as you can see, the programs are running in Vancouver, Toronto, Edmonton, and then Winnipeg is starting up next in this fall, yeah. So in terms of how it works, there's lots of different approaches and in terms of different things that happen, but basically there are kind of weekly workshops, boot camps, reading groups, meetings, and kind of this in-person working together with other young community folks. There's collaboration with mentors and experts in the field, and the investigators participate in the study design, in the recruitment and analysis, and getting experience in lots of different ways and with different types of research projects. And as you'll hear today, each of the investigators are encouraged or supported to lead their own individual research projects. So this could be something quantitative, something qualitative, or maybe mixed methods. They have presented at the CBRC Summit in the past, and they're presenting here today. They've also contributed to community reports, and have also gone on to lead their own academic publications. So the whole breadth of work that's been done and led by the investigators, and I think that's something really impressive, and it's always been something that I've loved about this program. So before we get into talking about Edmonton, As many of you may know, Edmonton was working with SexNow data, and to give you a bit of background on the SexNow survey, it is Canada's national queer men's health survey. It started locally here in Vancouver in 2002, and then expanded provincially and then nationally when we went online. And last year in the summer in 2018, we did in-person recruitment at 15 cities across Canada at Pride festivals. So you may have seen this slide already, but for 2018, it was in-person anonymous paper surveys with an optional dried blood spot for HIV and Hep C testing, conducted from June to September last year at these Pride festivals. And to be eligible to participate, you had to be a Canadian resident, over 15 years of age, or 18 to provide a DBS, and you had to identify as a non-heterosexual man or have had sex with a man in the past 5 years. And this work would not have been possible without the various community partners that have played an integral role across this country, and I really think it's important to acknowledge the work and support that we really appreciate from the CBRC. So now we'll be hearing from each of the Edmonton investigators about their various research projects. And they were encouraged to find something that they were really curious about from the SexNow 2018 data, specific to Alberta's context. And I'm just pulling up the bios now. Okay, so first up, we have Garrett Gooch. Garrett is the program coordinator for the Edmonton Investigators Group. He's currently a master's level student of counseling psychology, and he's passionate about mental health and improving access to services for vulnerable populations. And without further ado, please welcome Garrett.
Hey, y'all. So I'd just like to start off by saying that even though we're presenting our research individually, we really went about it as a team. Jonah was really instrumental in teaching us R and walking us through the analysis. And regular meetings with Aiden and Brooke and Jeff helped keep us on track and make sure we had everything we needed. And it was a really fun journey, so thank you. Okay. Oh, and so with that said, I decided to focus my research on the topic of mental health in Alberta's queer community, and in particular, whether there are any important differences between minority groups within that population. So even though we know that sexual and gender minorities as a group typically experience poorer mental health than heterosexual individuals, there are important differences in the mental health outcomes of groups within the SGM community. So taking into consideration the research of Olivier Ferlat on depression among sexual and gender minorities, high rates of depression and suicide were observed among transgender and non-binary individuals compared to cisgender individuals. So in order to make sense of these inequities, it's important to recognize factors related to minority stress and the multiple intersecting identities of SGM, including how these might influence their experience of mental health. So that's what I was curious about. So drawing from this past research, I wanted to investigate the mental health in Alberta's queer community. First, I wanted to explore the proportion of Alberta respondents as a whole who report experiencing symptoms of anxiety or depression. And second, to examine the experience of mental health problems among trans individuals in particular, including the issues they report wanting help with and the supports they're accessing and how those might differ from cisgendered or non-trans folks. So some methods. So as you know, in going about our quantitative analysis, the data for this study came from the 2018 SexNow survey. Women were excluded from the study, and participants consisted of queer and trans men attending Pride events. So mental health problems were measured using the patient health questionnaire and the generalized anxiety disorder assessment, which were a part of the survey and asked participants about their symptoms of anxiety and depression within the past 2 weeks. So those with significant scores for either measure were grouped together to represent individuals experiencing anxiety or depression. Trans folks were identified by their response to the question, do you have trans experience? Where anybody who did not answer yes to this question was then grouped into the cisgendered or non-trans category. Because the study focused on trans folks in particular, the non-trans group includes two-spirit and non-binary individuals as well as cisgendered individuals. And then odds ratios were then calculated to estimate the likelihood of trans folks belonging to the mental health group, as well as what issues they want help with and what supports they're accessing compared to non-trans folks. And what did we find? So we found that among Alberta's queer and trans population, 145 individuals report symptoms of anxiety or depression, so that's the dark blue, while 395 individuals report no significant symptoms. So just over a quarter of participants report experiencing mental health problems. When looking at trans folks in particular, just over half report experiencing anxiety or depression. It was found that trans individuals were 3.28 times more likely to report experiencing anxiety or depression than non-trans individuals. Some more results. So when examining the mental health concerns and help-seeking behavior of trans folks, we found that they are also more likely to want help with certain issues. For instance, trans folks were about 77 times more likely to want help with gender dysphoria than non-trans individuals. So while this may be unsurprising, we also observed how trans folks report wanting help with other important issues such as depression, anxiety, body image, eating disorders, and suicidal thoughts at a greater likelihood as well. In terms of the mental health resources they are accessing, trans folks are more likely to seek out more diverse supports than non-trans participants. And conclusions. So what does this all mean? So in discussing the implications of these results with peers, we agreed that trans folks are clearly very invested in their mental health and know where to find help. The results of our analysis show that trans folks are accessing supports at a much higher rate than cisgendered or non-trans folks, which might mean that they are experiencing more pain, they have a better idea of where to find help, or that they're simply more willing to get help. So when looking at these from a strength-based perspective, which I think is important, one way to interpret these is that non-trans folks can be viewed as a fountain of knowledge about mental health issues and available supports. They also highlight the large benefit of involving trans folks in mental health programming in general, which can help to improve the access and the quality of services for all groups within the SGM community. So even though I now have more questions about the mental health of the queer and trans community in Alberta, I feel like this study was a good start, and I learned a lot throughout it, so it was really fun. And that's all I got. So thanks for listening.
I also should have mentioned a few more things. First, to emphasize that all of these analyses that you'll see, the investigators ran themselves. So they learned how to use R, which is like a statistical analysis program, by themselves, and have produced these plots. You can also see these analyses more in depth in person during the poster session happening from 6:30 to 8:30. So if you have more in-depth questions about those or want to see those figures up close. And lastly, we're going to present all of these 5 presentations from Edmonton, and then we'll leave some time for a broader Q&A. So if you have any questions kind of coming up, then you can write them down and save it for then. So next up, we have Brandon Lansell. Brandon is currently working on the Totally Outright program in Edmonton. He also sits on the board of directors for the EMHC, or the Edmonton Men's Health Collective. So please welcome Brandon.
Hello, everybody. My name is Brandon. I use he, him pronouns. Let's get started, and I'm hoping to keep this short and sweet. So with our introduction, I guess one of the main things when we were looking for data to reference when we were going about conducting our own analysis was that I just find it a real privilege that most of the references that I was compiling come from people who have spoke at this summit. For the methods for my Oh, I'm a little nervous, sorry. Yeah, got it, on it. Yeah, I pulled from the 2018 Sex Now survey. I had broken it down into the Alberta respondents, so those who said they currently reside in Alberta, of which we had 582 people. And then I further had broken it down into age cohorts. I had used two, so age 16 to 29, and then age 30 plus. I had broken it down this way because this is kind of the closest I could get to a 50-50 divide. And then I compared instances of discrimination between the general population and the GB-MSM population. So I have one of my graphs here. I have another one on my poster as well, so if you have any other questions, please feel free to come and find me. But essentially, when I was going through the data, I couldn't find any clear association of instances of discrimination between age cohorts at a provincial level. And then all instances of discrimination had a larger number of instances come from the general population versus the GB-MSM population. When we're talking about the results, I thought one of the most interesting things about looking at the instances of self-reported discrimination was that we were seeing like quite a similar grouping between self-reported instances from within the community and from the general population as well. So with the survey and the questions that we asked, we didn't have enough different types of questions to figure out why, but this could potentially be showing something like parallel trauma. Yeah, so in conclusion, in almost all types of discrimination, reported experiences were similar between discriminations coming from the GB-MSM community members and the general population, and discrimination in the past year based on age, body, gender, and sexual orientation did not differ by age cohorts, suggesting that these experiences are commonly experienced among participants. And that was it.
So next up we have Jonah. Jonah is an almost cognitive neuroscientist whose commitment to social justice has reoriented him towards community-based research and nonprofit work. He is passionate about community care, youth empowerment, knowledge accessibility, and inverting power structures wherever possible. Please welcome Jonah.
Hey everybody. So when I was thinking about what kind of question I wanted to ask given the Sex Now survey, I started thinking about why I joined Investigators in the first place. I actually was really afraid of particularly the cis part of the GBS-MSM community. This probably comes mostly from the way that I, in the past, had been mistreated repeatedly. So in general, I was finding that even in social spaces, I was being boiled down to sort of like my body and my genitals and stuff like that. And that really made the community overall feel inaccessible to me. So I started wondering, like, I started wondering kind of like who is having sex with trans people if cis people think that we are so disgusting. So don't be afraid. I don't think you all think we're disgusting, but the way that cis men in social spaces and in sexualized spaces have been talking to me really suggested that they saw me as trans first and a man second. So I'm going to skip my official background slide because I hated it. So overall, thank you. I looked at the Albertan respondents from the Sex Now survey, and I looked at the people who, I looked at the responses to the question, have you had sex with a trans man, a trans woman, or a non-binary person in the last 6 months? 7.7% of the respondents had said that they had had sex with a trans person in the last 6 months. I found this a little bit shockingly low, but I mean, not given the things I said in the preamble. So I was wondering maybe if multiple marginalization would make people more likely to see trans people through a lens of compassion. And I looked at a bunch of demographic variables to see if things like racialization or HIV status or age predicted whether or not people were having sex with trans people. So overall, I found that trans people themselves were 10 times more likely than people who didn't identify as trans to have slept with a trans person in the last 6 months. I think this is pretty unsurprising. Trans people in general understand what it's like to be a trans person, and we are seeking each other out to have sex with without having to worry about explaining gender to our sex partners. I also found that people who identified as bisexual, pansexual, or queer, but not gay, were 9 times more likely to have slept with a trans person in the last 6 months than someone who identified as gay. I think this also is unsurprising. Bi folks are obviously open to people from a variety of genders and are probably not scared off by different types of bodies. Within the trans group, I compared rates of having slept with a trans person between bi trans people and gay trans people, wondering maybe if that effect of transness was actually also an effect of that bi effect that I showed there. But between bi trans guys and gay trans guys, there was no difference in likelihood of sleeping with a trans person. So this shows that even gay trans guys are still a little bit more open to having sexual experiences with trans people in general. Within the bi group, trans people were 3.26 times more likely to have slept with a trans person in the last 6 months. And within the gay group, comparing trans and cis people, trans people were 14.46 times more likely to have slept with a trans person in the last 6 months. So I think overall this shows that within the queer community, there's sort of a bunch of differences according to who you are about whether or not you're having sex with trans people. I also found that people who had had sex with a trans person in the last 6 months were a little bit younger than people who had not. And when I started looking at the other demographic variables, I found that being racialized did not make you more likely to have slept with a trans person in the last 6 months. Not being born in Canada, HIV status, and your financial stability had no effect on your experience with trans people, your recent sexual experience with trans people. People who had bought sex in the last 6 months were 7 times more likely to have slept with a trans person as well. This could be driven by sort of the co-occurrence of being a sex worker and being trans, that people who are seeking out sex workers may be seeking out trans sex workers in particular. I did look at whether or not people who were seeing sex workers were more likely to have had sex with a trans woman in the last 6 months, as being a trans women are more likely to be sex workers than trans men, just given who sees sex workers, but there was no effect. I also found, strangely, that people with more education were less likely to sleep with a trans person, to have slept with a trans person in the last 6 months. This was a weird effect, so I looked into it a little bit more, and I found that bi people in the sample were actually less well educated than people who identified as gay in the sample. So a side weird effect. So overall, if we look at your willingness to have sex with a trans person as a measure of trans inclusion, which is sort of what I was thinking about here, if you are trans, bi, younger, or if you see sex workers, you are more inclusive. Haha, you can feel good about yourself, just kidding. The limitations of this, obviously, are that this only goes back 6 months, so if you're not hooking up with a lot of people, it's possible that you just didn't hook up with any trans people in this half year. It also is a single measure. This is a single question: have you had sex with a trans person in the last 6 months? Obviously, this doesn't show everything there is to know about inclusion. Though, I think that in some ways it kind of does, right? Like, if you are unwilling to sleep with a trans person, what does that say about your feelings about gender and about trans people in general? I think it's important to note that trans people often experience this particular kind of cis sexism, where you are always viewed as sort of like a walking set of genitals, and you're always othered in this way because of your body and your birth-assigned sex. Overall, I think that this sort of shows that there's a bit of a gap in the way that trans men within the queer community are being treated, and we probably need to do some education around kind of like, what does sex mean when it involves a trans person? What are trans guys anyway? Like, I'm asking myself that every day. What are trans guys? So yeah, thanks.
So next up we have Clay. Clay is a volunteer researcher with the Edmonton Investigators Program. His background is in leadership and event planning and management and communications. These focuses have created a passion for building relationships and growing community. So please welcome Clay.
Hi. So, first, before I start, actually, if you go back there, it's not just my name on the research here. I did have a partner in crime, Shane, who wasn't able to come to the conference, so I just want to take a moment to acknowledge the work that he put into this as well, and to thank him in front of you all. I wanted to look at, sorry, I'm super nervous. I wanted to look at the relationship between marginalization and community satisfaction, particularly among queer Albertans. Previous discussions on community interaction and satisfaction have acknowledged that marginalizations compounded on queerness affect these groups differently than the community at large. So Shane and I asked, how do intersecting marginalizations such as race, trans identity, and/or age affect overall satisfaction with one's relationship to and in the queer community in Alberta? So again, like everyone else at the table right now, the study focuses solely on the Albertan participants of the 2018 Sex Now survey. The group, the cohort that we refer to as racialized in this study was established by grouping all the respondents who identified as any ethnicity besides white, establishing a Black, Indigenous, and people of color cohort. You can see there were 189 BIPOC respondents and 392 white respondents. The age cohort was established in relation to the AIDS epidemic, with the pre-AIDS epidemic category being respondents who were born before 1981, and the post-AIDS epidemic being those born after 1981. We split the age cohort of respondents by this because we felt this to be a significant generational divide in the community. So overall, the satisfaction with LGBTQ2S+ community connection, this is all Alberta respondents, was 55% satisfied, 23% didn't know if they were satisfied with the community, and 22% said they were not satisfied with the community. There was a slight drop in satisfaction with community connection when comparing the pre-AIDS epidemic group and the post-AIDS epidemic group of 3% difference. Which we found through testing in R was not significantly associated with each other. So there's a 3% difference, but it didn't really seem to have to do with age. Racial identity is significantly associated with community satisfaction. We found that 58% of white respondents said they were satisfied overall with the community, while 46.8% of respondents who were racialized said that they were satisfied. So this is a 10% difference of those who are racialized from the average, and in an 11.5% difference between white respondents and racialized respondents. What we feel this told us is that intersectionally marginalized parts of the community have very different levels of satisfaction with their connection to the community. The one thing, I didn't have it in the slide because we were only supposed to do 5 slides, so you can see it all on my poster. There's a lot more graphs and stuff. One thing that was interesting that we did find was that BIPOC members of the community born before the AIDS epidemic began expressed a higher level of satisfaction with community connection than younger respondents, which was something that we definitely thought would be worth looking into specifically further. But overall, the results of the survey definitely reinforce the claim that queer spaces can benefit from more diverse planning, as well as the creation of new diverse spaces to enable better and more meaningful participation within the community by all community members. Thank you.
And last up, we have Finn St. Dennis. Finn is the community trainee for the Edmonton Investigators Program. They're currently completing a master's in community engagement and is interested in research that works with the communities as active participants in the research process. So please welcome Finn.
So, numerous scientific studies have clearly demonstrated that people with HIV who maintain an undetectable viral load are unable to sexually transmit the virus. The implications of undetectable equals untransmittable, or U equals U, are significant, especially when we start talking about treatment as prevention strategies, as well as when it comes to reducing the stigma around HIV. Despite this fact, there are still a lot of folks who are not aware that U equals U. Although the U equals U campaign launched in 2016, it was met with initial reservation. And it wasn't until 2018 that the campaign started gaining critical mass, with the most pivotal moment of 2018 coming on December 1st, when Canada became the first government to formally endorse U equals U, and the Minister of Health discussed the importance of this campaign in combating HIV-related stigma. So like everyone else from Edmonton, I looked at the 2018 Sex Now survey, specifically Alberta respondents. And if you'll recall, this data was collected in the summer of 2018. So this places our data collection right in this moment where the campaign's really starting to build momentum, but also before the official endorsement happened. In terms of my data analysis, I initially grouped respondents based off of HIV status. I then compared answers to 9 different questions regarding sex with men in the past 6 months with respondents of awareness of U equals U to look at whether or not those who knew U equals U were more or less likely to have engaged in these behaviors. 100% of the HIV positive respondents knew that U equals U, so I wasn't able to do any analysis on this specific group since I had no folks who didn't know U equals U to compare with. And due to the relatively small number of individuals with an unknown HIV status, I wasn't able to find any statistically significant relationships. So the analysis presented here is going to focus on the entire Alberta pool of respondents, as well as the HIV negative group, which was our largest respondent pool. So the first thing that I wanted to look at was how many people in Alberta actually knew U equals U. And of Alberta respondents, 69.7% were aware before completing the Sex Now survey that someone with an undetectable viral load could not sexually transmit the virus, whereas 27.7% were not, and 2.6% of respondents did not answer the question. When I started looking more closely at the sexual behaviors, I found that survey respondents with an awareness of U equals U were more likely to engage in certain sexual behaviors than those who did not know. Of the overall Alberta pool, those who knew that U equals U were 1.9 times more likely to ask a partner about their status. They were about twice as likely to have had a one-night stand or a hookup in the last 6 months. And the next two are really significant to me. They were almost 7 times more likely to have had sex with someone of an opposite HIV status, and just under 6 times as likely to have had sex with someone with HIV with an undetectable viral load. There were also a handful of behaviors that I looked at where the data did not show a significant relationship with U equals U knowledge. In other words, knowing U equals U did not mean that folks were more or less likely to have engaged in these behaviors over the past 6 months. These results demonstrate that U equals U awareness does relate to likelihood in engaging in certain sexual behaviors, such as having sex with someone of an opposite HIV status. While this study is only able to demonstrate that this relationship exists, and we can't say for like 100% certainty that U equals U awareness is the reason that we're seeing this, it is likely that the campaign is having an impact. The fact that Albertan respondents who know U equals U were almost 6 times more likely to have had sex with someone with HIV with an undetectable viral load suggests that the campaign could possibly be reducing stigma associated with HIV. It's also interesting to note that those with U equals U knowledge are more likely to have had sex with someone of an opposite HIV status, or in other words, were less likely to serosort, which may suggest that U equals U knowledge might be reducing the level of risk that is felt. Those with U equals U knowledge being more likely to ask a sexual partner about their status could suggest that they have a higher awareness of general sexual health best practices, whether that's because those who are generally more literate in sexual health were more likely to have been exposed to the campaign, or if having been exposed to campaigns like U equals U encouraged people to further engage with sexual health best practices. In terms of the behaviors where we didn't find any significant relationship, we might have expected to see a relationship with some of these behaviors, and there are a couple of potential explanations for why that was not the case. It is possible that there were other compounding factors beyond U equals U knowledge that explain the rates at which these behaviors are occurring. It's also possible that given the timing of data collection in relationship to the timeline of the U equals U campaign, we may see a relationship in future surveys once the campaign has been active for longer and more people have actually started to adapt to this knowledge. So it would be prudent to collect data in future iterations of the Sex Now survey to provide a better picture of the long-term effects of this campaign. Data collected in future surveys could be compared with this data to gain a better sense of trends and changes that occur as the U equals U campaign becomes more widely known and understood.
Okay, wow. Okay, so maybe one round of applause for this entire panel. That was a lot of work and a lot of impressive efforts. Before we switch cities, is there one question from the audience that we could ask? Olivier has a question?
No. Okay, I'll talk. Oh, yes. Ooh, shit. Okay, I just want to, first of all, congratulations. All your presentation were very good. What I'm seeing is a lot of your final slides finish with like, oh, we need to do more research on these topics. So I'm wondering if you already have suggestions about variable that we might be include in future Sex Now survey or in future surveys.
Either, whoever. Just you could try.
All right, so this is not related to the question that I looked at, but what I originally actually wanted to look at was specifically looking at non-binary Albertans, and the way that the question was phrased in the 2018 Sex Now survey asked if you were male, female, or other, but didn't actually have a specific non-binary category. And given the recent recognition that non-binary folks have had with X-gender markers, I think it's definitely important that that's included going forward so we can have a better picture of specifically non-binary respondents.
Does anyone want to add anything?
I think expanding on that, throughout this 6-month process, we've definitely all found places where we definitely have some input on how future iterations of the survey could change, expand, or address things that when we went through it, we were kind of like, oh, you missed this. So I'm a very opinionated person. I'm more than happy to share that with you.
Something for cocktail hour. Okay, so thank you to the Edmonton crew. And now I'll invite the Vancouver investigators and the Toronto coordinator up to the stage now, please. You're amazing. Okay, so now, first we're going to hear from the 3 of the Vancouver investigators who actually did research on the qualitative project that we're going to hear about. So I'm just going to introduce the 3 of them all at once, and then they'll kind of take it over from there. So first we have James Young. James is a Master of Public Health candidate at Simon Fraser University and an evaluation specialist with Providence Healthcare. He also volunteers and does part-time research with the CBRC, and he's excited for his first time presenting at an academic conference and is thankful for all of the opportunities the CBRC has provided him. Stephen Juono is an undergraduate student studying integrated sciences at UBC with a public health-related minor and a volunteer with the CBRC under their investigators program. He would like to thank the CBRC for this opportunity to further develop his skills in research and for their help in helping him be more involved with the community. And lastly, we have Scott McLaren. Scott is an electrical engineer in training by day, but loves engaging with healthcare research with the investigators, especially in terms of queer patient clinical interactions, patient self-advocacy work, and healthcare policymaking. And with that, I'll turn it over to James.
Does this work? Hi, thank you, Aiden. Okay, so our presentation is entitled Investigators YVR, insert prep pun here. And this is because through rigorous research, we have determined that every single prep pun has already been used. There are none left. In all seriousness, first I will give a very brief background on publicly funded PrEP in BC, for those who may not be familiar with it, and then I will introduce the methods of a participatory study the investigators have been involved with alongside the BC Centre on Substance Use, University of Victoria, and the CBRC. Afterwards, Stephen, Scott, and I will each be presenting some preliminary findings from the study. So, as of January 2018, pre-exposure prophylaxis, or PrEP, has been publicly available for most gay, bisexual, and other men who have sex with men, or GBMSM, as a HIV prevention method in BC. But the steps required to access PrEP are very different than the steps required for other prescription medications in BC. It requires individuals to have sensitive conversations with healthcare providers and navigate their way through many steps in order to access PrEP. Understanding the experiences of GBMSM accessing PrEP can help to improve our current system and also inform scale-up of public access to PrEP in other Canadian settings. Given that the process of accessing PrEP is different than accessing other meds, we were interested in inviting GBMSM who were accessing publicly funded PrEP or in the process of doing so to talk about their experiences. We did so in the form of semi-structured qualitative interviews, and as investigators, many of us participated in helping to create the interview guide and participate in the interviews. We also helped to transcribe them verbatim, and then each investigator developed their own research question, search query for in vivo, and then did coding and thematic analysis either on paper in Microsoft Word or in vivo. Participants were recruited from clinics such as the Health Initiative for Men, from healthcare providers, and through social media, and then the participants were de-identified and given pseudonyms to preserve anonymity. And briefly, I'll give you a brief participant summary. So we interviewed 28 people. Their ages ranged from 20 to 54, but most were about 30 years or younger. Approximately 2/3 identified as Caucasian, and most had some form of post-secondary education and were currently taking PrEP. So the research question that I chose to explore is, what do GBMSM identify as reasons that they would stop using PrEP? I chose this question because I figured that if someone has already gone through all the processes involved in order to access PrEP, it would be important to learn from them about why they would stop taking PrEP. And so, throughout these interviews, participants were specifically asked to elaborate on whether they could foresee themselves stopping PrEP in the future or if they'd already stopped PrEP before. When analyzing their answers, I found that 4 main themes emerged. The first, and one of the most common themes that emerged, was that GBMSM said they may stop taking PrEP because of side effects. For some, this had already caused them or someone that they know to stop taking PrEP and potentially without seeing their doctor about the side effects either. Overall, as summarized by Dexter, participants felt that if the side effects outweighed the benefits of PrEP, they would stop using it. The other most common reason that GBMSM said they would stop taking PrEP was if they entered a committed relationship or where they were only having sex with one person, or if they started reducing the amount of casual sex that they had. This theme boils down to a shift in risk perception, and I feel it's summed up well by Esmeralda, who said, for example, now, like the Pride season has gone, so it kind of slows down, so I might just kind of stop using PrEP, and then if I need it in the future, then I can make sure that, make sure that I'm negative and stuff like that, and restart PrEP. Many interviewees also brought up cost. Given at the time of the interviews, PrEP had only recently become publicly funded, many participants, like Riley, pointed out that if the province decided to stop funding PrEP, if they could no longer afford it, then they would stop taking it. Finally, while this theme was a bit more uncommon, commitment to the PrEP regimen was another theme that emerged. Participants talked about things such as having to go in every 3 months for various testing to get PrEP, to having to take the pill daily. For example, when Hussein was asked what had influenced him to stop taking PrEP, part of his response was, I know this is going to sound bad because it's a pill you just have to take once a day, but it was a little bit of a hassle to take a pill every day because I wasn't before. So, why does this matter? Understanding why GBMSM stopped taking PrEP is particularly important because conversations with key stakeholders have revealed that a number of recent seroconversions in BC have been among guys who had recently stopped using PrEP. And this means that there's definitely room for improvement in BC's system. As I looked over the 4 themes that emerged from these interviews, I thought about a number of important considerations. First, side effects from PrEP are definitely on the minds of many GBMSM. Misinformation about side effects could lead some GBMSM to discontinue PrEP or may prevent others from starting it in the first place. Ideally, physicians can regularly check in with GBMSM about side effects and PrEP in order to help ensure that they have accurate, up-to-date information to help them best navigate PrEP and any potential side effects. Second, our perception of risk is often fluctuating, and that can lead some GBMSM to stop using PrEP. This highlights the need to try and find innovative ways to help GBMSM who have stopped taking PrEP identify when they may want to start taking it again and to make that process as seamless as possible. I'm not sure what that would look like, whether that means offering a week-long take-home supply of PrEP for those who stop, if they want to start taking it again immediately, offering regular phone call or text check-ins after someone stops PrEP, or something else. Third, I think the cost factor just really underscores how important it is for the province to continue to fund PrEP and how vital this funding has been for many GBMSM. And finally, the reality is that for some folks, taking a pill every day and the process of accessing PrEP is a burden. On-demand PrEP may be an alternative solution for some, so increasing both GBMSM and physician awareness of this prescribing method is important. And looking towards the future, long-acting PrEP would clearly be welcomed by many GBMSM. Ultimately, as these interviews were conducted quite soon after PrEP became publicly funded, it will be important to follow PrEP use trends over time and reevaluate the reasons that GBMSM stopped using PrEP. There are surely other reasons they stopped taking PrEP that were not covered in this presentation today, and more may emerge as new research is undertaken and as PrEP is further established in BC. As they do, it will be important to continue to develop and refine strategies to ensure that GBMSM who may benefit from PrEP continue using it. Thank you, and I'll pass it over now to Stephen.
Hi everyone, it's a pleasure to present to you today. My name is Stephen and I'll be talking to you about how different social circles affect knowledge and perceptions of PrEP. So to give this topic a bit more context, let me talk about myself a bit. So I grew up in the suburbs of Vancouver in a rather conservative immigrant family, and I never had the courage to talk about my own sexual health, let alone talk about PrEP in much depth. This all changed quite recently when I got into university and had various discussions with my friends. I learned that they all had different avenues of seeking out information, and as a result, had different perceptions of sexual health and topics like PrEP. When I was given this opportunity to research, I wanted to see what our participants and how our participants were influenced by their own social circles. Through thematic analysis, I came across 3 main topics involving friends, sexual partners, and your family members. The predominant theme was that friends are often the primary source of information. I think this makes a lot of sense, considering you generally trust your friends, you generally hold their opinions to a high degree, and you like them. From our data, I found that friends often polarize our participants by either being advocates or deterrents for PrEP use. When one of our interviewers asked Hector what his friends' opinions were of PrEP, he was faced with rather stigmatizing and negative language. His friends called PrEP users Truvada whores, and later on, Hector had to rationalize his friends' comments, and he was brushing off their negativity by stating that they were merely joking, that they didn't mean it. Upon reading this quote, I realized that there was this underlying conflict between what his friends were saying and what his own perceptions of PrEP were. And for him to resolve this conflict, he had to merely state that they were joking and that it's fine. In contrast, we had participants such as Peter, and who was met with more neutral or PrEP-eager responses. As Peter mentions here, he first learned about PrEP through his friends, and this makes sense, as your friends are probably more able to effectively tell and pass down information. My next major theme involves sexual partners. And in multiple interviews, there are mentions of dating apps such as Grindr that openly state PrEP status on the user profiles. Many participants said that this increases the exposure and awareness of PrEP, but also reduce the amount of actual discussions made, as sometimes it might evolve to, hey, just wanted to confirm that you're on PrEP. Yeah, I am. You? Yeah. With that being said, some of our participants did find out about PrEP through their sexual partners, such as Patrick here. Patrick mentions, I found out about PrEP through my partner, actually. When I was dating, he's positive, so the topic came up. With PrEP being more accessible, I suspect that there will be less apprehension towards men who are positive or undetectable, and overall, sexual partners will generally favor PrEP use and are more likely to know about it, granted that you inquire more. My last major theme involves your family members. As Tom mentions here, your parents, it's like, yeah, I don't want to tell you about my sex life, but also, my parents aren't fully accepting of the fact that I'm gay, so it's like, I don't want to add more fuel to the fire, and they probably don't even know what this PrEP is, so like, what's the point, type thing. In every single one of these interviews, they mentioned that there's this barrier of coming out to your family, and because of that, they defer to their friends, to their sexual partners to find out more information. To wrap up what my presentation was about, I found that friends are an important highway of information, and they generally, well, they often are quite biased in how they present this information and skew our participants' perceptions of PrEP. Moreover, dating apps with PrEP status on the user profiles and discussions with sexual partners facilitate PrEP knowledge, as well as create this new type of relationships that wouldn't have never formed otherwise. Lastly, our participants never referred to their family as anything about their sexual health because of this added barrier. And I'm curious to see how in the future these 3 topics will evolve in how they influence PrEP perceptions in our participants as PrEP becomes more accessible. Thank you, and I'll pass this over to Scott now.
Hi everyone, my name's Scott and I'm just delighted to be here. So the focus for my analysis was on barriers that young MSM are perceived to have, or perceived to accessing PrEP to their general practitioners. So in Vancouver specifically, I know for not everyone is from Vancouver, not everyone has a GP and getting a GP is very difficult. But for those of us that are privileged enough to have a GP, is this resource being used effectively for accessing PrEP? So in short, not quite. So for context when this was being done, when PrEP was first introduced, the HIM clinic in Vancouver had a backlog between 2 to 3 months to see their doctors. And as we all know, your GPs can fully prescribe PrEP. So we wanted to, or I wanted to analyze why aren't people with GPs going to see GPs for PrEP. So the first big thing that came up that is no surprise is fear of judgment from your own GP. For many people conversations came up a lot that coming out to their doctor to access PrEP was too high of a burden and that waiting these months wasn't a better alternative. So from our participant Hector, he quoted saying, HIM was like sort of an easier alternative. Like, I have my family doctor here, I don't know what he's going to, I don't know how he's going to react. Now I can just go to him and it's, you don't have to worry about that. So for them, escaping that judgment potentially from their own GP, it was worth waiting the months to access PrEP. So another participant said that I would not be comfortable with going to my doctor to talk about it because I'm not out to him and I feel I would be judged. So the stress and the fear of judgment, this is too high of a burden for people to overcome, and doctors, from this respect, they're not being well utilized because they're too afraid to see their own doctor to talk about their healthcare needs. So another theme that came up was concerns about doctors' own queer competency, their knowledge about PrEP itself, and their knowledge about the PrEP pathway in BC, which is very particular to BC itself. So one of the participants said that, I guess the one downside is like, I'm educating my family doctor on this, but like there might be information that I don't know that these doctors out here, these doctors here at the HIM clinic might have. So it'd be nice to have that kind of conversation with them rather than, here, sign this form, I need you to do this. Patients aren't looking for a transactional relationship. They want to make sure that their doctors actually have the knowledge that they need to access PrEP effectively, and our participants weren't feeling that their GPs had this knowledge. So for Dexter, another participant, with the context Dexter had accessed PrEP through his family doctor, but this was him talking to his friends about his experience. And he said, you can go to your GP, but they probably won't know anything about it. And if you're a friend of Dexter, that's not exactly encouraging that you should go to your GP. So another theme that came up, which to me was very interesting, was we had a few examples of patients not wanting to go to their GP because they felt that they would make their doctor feel really uncomfortable and they wanted to spare their doctor from this potential discomfort. So Chase said, quote, doctors are only used to seeing like families with babies and elderly people talking about their arthritis. And then all of a sudden you're throwing this PrEP gauntlet at them. And I think for people who maybe are not as well immersed in the PrEP pathway, it really does feel like a gauntlet. You have to jump through so many hoops and so many steps to actually get on PrEP. And with the doctor side itself, it's more of a commitment than doctors may be useful for other medications. So Hector said similarly, so I didn't really talk to my doctor about PrEP because I don't know if he'd be comfortable talking about that subject. And again, we see that these participants are sidelining their own healthcare needs to make sure that their doctor feels good at the end of the day, which is really tragic. So in summary of this, I want to talk about that, how some participants, like the feeling of potential judgment and having to come out to their doctor was so intense, they would rather wait 3 months to access PrEP than go see a doctor that they've maybe had for years. And again, we see that doctor knowledge isn't quite there yet, and that when we have these participants coming out saying, oh, my doctor didn't know anything about it, and they tell their friends, that's not exactly going to encourage people to go see their GP and potentially help the HIM backlog. And finally, as I said, people are putting their doctor's comfort over their own healthcare needs, and that's wrong. Like, people need to get with their healthcare. They need to be, they need to get the healthcare access that they need. So, so as a part of this in the Vancouver team, well, this was more specific to my research question, we developed a toolkit as part of our knowledge translation called Accessing PrEP Step by Step, a queer guy's toolkit for effective self-advocacy in BC. And what this toolkit is it's a step-by-step guide to how a patient would access PrEP in BC, potential conversations with your doctor, and it kind of helps to hold your hand along the whole process. Because as we heard, accessing PrEP is like throwing your doctor through a gauntlet, and any help that we can get is great. There's even a little section in the booklet itself which is a talk to your doctor, or it's a doctor-to-doctor talk. We're going to continue with these analysis and continue hopefully with more of our interviews and hopefully go forward to doing some written manuscripts for this research. We would like to give some big thank yous to Dr. Rod Knight and Carolyn Mishuk and Anna Carson, Dr. Mark Hull, Nathan Lashowski, and Simon Brayak for helping us stand on the shoulder of giants to actually get this going. And while not all of us could be up here to present, many of us were actually able to do posters for our presentations, and they cover topics like looking into the HERE Restore itself, flow and access to accessing PrEP, preferences for model of care, and changing harm reduction practices. And I will hand it back to our moderator.
That was amazing. So I'm being told that I realize that we're running behind schedule, so I don't know if we'll have time for a full question session, but I do want to reinforce that there's investigators will be present at the poster session in case you have follow-up questions, and there will be hundreds and hundreds of copies of these PrEP self-advocacy tools if anyone is looking for a hard copy. I'm going to... Okay.
Really, really quickly.
Okay.
I want to witness and honor and acknowledge and celebrate, and it gives me such hope for James, Stephen, and Scott, and to hear your heart and your community within your work. And Stephen, thank you very much for positioning yourself. That is so beautiful and so honoring, so thank you. The one observation and reflection is I challenge the January 1st, 2018 timeline, and that must be qualified. On February 26, 2016, when Health Canada made the determination that PrEP was, Truvada and the generic was available, it was listed on FNIB, and First Nations and Inuit people had access to publicly funded PrEP here in BC and across the country. So on January 1st, everyone else got access to it, but we as First Nations and Inuit people had access to publicly funded PrEP. We must keep that history and that narrative going, because within that 2-year period, no one told us. Health Canada, First Nations Health Authority, and the PrEP advocates that were advocating did not let us know that. So that must be brought forward, and we must keep that narrative and history alive, because it was a huge missed opportunity, and it is First Nations and Inuit people that bared the brunt of that huge missed opportunity by us zero converting, because we did not know that PrEP was available and publicly funded.
Thank you, Harlan. So to just close out this session, we're lastly going to hear from Alex Oliva. Alex is passionate about intersectional work that addresses systemic inequality affecting LGBTQ+ and queer, racialized, and Indigenous folks, and that pursues physical and mental well-being for marginalized groups. Alex also has a great interest in media representation and critical analysis, and they have experience working on sexual health and mental health initiatives. Alex currently works as the coordinator of the 3rd Toronto Cohort of Investigators, a joint OHTN Cruise Lab initiative that trains young gay, bi, trans, non-binary, and queer guys in community-based research skills. Please welcome Alex.
Hi, everybody. So we're all tired, and it's been a long day, but a great day. And thank you all for being here. So I'm going to talk about what we do at the Toronto Investigators. So first I want to declare conflict of interests. I'm the coordinator of the Toronto Investigators program, which receives funding and in-kind support from the Ontario HIV Treatment Network. And so what is the Toronto Investigators? We have a bit of a different structure from the Vancouver and Edmonton Investigators. It's training for gay, bi, trans, queer youth in community-based research to equip them with tools in order to understand research about them. So research for them, by them. So what we've done so far have been various topics such as endemic social determinants of health, history of gay men's health research and LGBTQ activism in Canada, and all those other things. And we're really looking forward to continuing and expanding topics. Today has been a great day for learning more and thinking about different opportunities and working with some of you folks. A big part of our program too is the social outings. So we want to create a space for youth to connect outside of apps, bars, and nightclubs. So this gives us an opportunity to connect with each other in casual ways. And what is coming up that we're really excited for next is the HPV Symposium on November 22nd in Toronto. So this is organized by the HPV team at St. Michael's Hospital, and it's a great opportunity for the investigators to learn facilitation moderation skills. 6 of them will be moderating breakout sessions close to the end of the day, and they'll be learning about HPV and about how to raise uptake among young GBMSM. So, and now I want to acknowledge everyone who has helped us reach this point, the Community-Based Research Center for Gay Men's Health in Vancouver, the Toronto Research Team, and then thank you all for this. And you can contact myself or David J. Brennan at these addresses here. All right, well, thank you very much.
And so just to close this session, if anyone is curious to learn more about the investigators, you can contact the local coordinators, or you can speak to Brooke Biggin, just right over there, and he will answer all of your questions. And thank you so much for staying. Thank you so much for your support. I'm really, really impressed and grateful to just even be a part of anything investigators related. And I'm just supposed to remind everyone that there is a poster session from 6:30 to 8:30, and that there is a free drink ticket. So please come, and also come to support the investigators some more. So yeah.